Xu Feng. Good afternoon, my colleagues. So today I'd like to share with you the CSP case. 28 years old, Miss Zhang.
So, the basic information of the case and of the history of the present illness, as you may see from the slide, Doppler ultrasound, intrauterine pregnancy, 12 plus weeks and single live birth, fetal malformation, and then the mileprostone plus misoprostol during a drug abortion and no progress in labor. And the cartilage were performed during under intravenous anesthesia, and the bleeding was about 800 millimeters. The balloon was compressed, and the B ultrasound showed that the lower anterior wall of the uterus was thin, and the size of the residue placenta tissue was about 4 plus 5 centimeter, which was closely related to the scar in lower uterine segment. And the blood flow was abundant. Scar, pregnancy, and placenta implantation were considered. So, with the history of the present illness, with 2019, the UAE conducted or performed after the operation. The hemoglobin was 71, and 2 units of the red blood cells were transfused. And also, we have some diagnosis according to this case. Is the placental accreta and scarred uterus pregnancy. And so with the treatment of HIFU strip surgery, with the total energy 536,200 J, and total treatment time is 1,500 seconds, and the operation time is 170 minutes. As you can see, this is the MR image before the HIFU treatment on 429 seconds of the treatment. This is contrast enhanced ultrasound show a significant decrease in blood flow and drain of 20 millimeters of liquid from the balloon and leave 10 liquid. So this is the 700 seconds and 1,124 seconds of HIFU treatment. So we continue to drain 5 millimeters of liquid from the balloon, and the remaining 5 millimeters and 1,500 seconds of HIFU treatment. So after the treatment, 5 millimeters of liquid in the balloon and withdrawal of the intrauterine balloon without any vaginal bleeding. And so this is the before and after contrast of HIFU treatment. So very satisfactory outcome of the ablation. So the sixth day, the patient was discharged from the hospital, and 25th day, and the lesion shrinked. So with the fertility requirement from the patient, so 1 month after HIFU treatment, we had this cartilage. And after 1 month after the cartilage surgery, and the uterine size go back to the normal. And after the hysteroscopic surgery, and with very clear contour of the uterine cavity. So with the fertility requirement, we have our own solutions of a portfolio, and this patient is still followed up by us. And so the way we have to discuss the best way to induce labor and the timing of the uterine artery embolization. And that is the sharing of my case.